The way fluorescent cystoscopy or photodynamic diagnosis works is we first place a catheter in the bladder of the patient and instill a chemical. This chemical gets specifically taken up by the cancer cells in the bladder itself. The cancer cells will then glow red when a blue light is shined on these cancer cells. What you see on the screen is a picture of the inside of a human bladder. This is a patient with bladder cancer. The top picture shows you a tumor that is growing out like a polyp from the inside of a patient's bladder. And as you can see, on white light, all you see is a big polyp. But when we shine the blue light, the whole interior of the bladder appears blue, except for those areas of tumor which are glowing red. And when you look at the white light, you can only see one tumor. When you look at the fluorescent cystoscopy picture, which is at the bottom, you see multiple tumors. Now let's go over how we perform a cystoscopy in a patient using the fluorescent technique. What I have in my hand here is a specific and specially designed fluorescent cystoscopy scope, or a photodynamic diagnostic scope from a particular manufacturer. This scope looks just like any other routine cystoscope that we use normally to insert into a patient's urethra and examine the inside of the bladder. It has a long steel rod which is fairly thin, and this, once the patient is anesthetized, goes in through the urethra without causing much pain or trauma, and we can actually take a look inside the bladder. This is the camera unit, and this is the light source unit. The camera unit here is the one that's very specially designed, particularly for fluorescent diagnosis. And this contains the ability to shine both white light as well as blue light. Normal cystoscopes can only shine white light using a light source such as this. This light box, however, is special. It is specifically designed for this type of diagnosis because it can emanate both white light as well as blue light. And that light is shown through this camera, and we can change the type of light. We can by just pressing a button. And in this blue area is a button, and if you press that button, it shines a blue light into the bladder. And this white area is a button, and if you press that button, it will shine white light into the bladder. And thereby, the urologist can change between blue and white light being shown into the bladder just by pressing a button on the camera. The data suggests that about 25% more tumors are identified in those with polyp-like tumors, and about 20% more tumors are identified in those patients with carcinoma in situ. Several more people will be identified as having bladder cancer just using fluorescent cystoscopy alone, who would have otherwise been missed if we had just used white light cystoscopy. Likewise, even in patients who have a known bladder tumor, we can find a lot more bladder tumors if we use fluorescent cystoscopy rather than using just white light cystoscopy. Studies have shown that more complete tumor removal right at the outset will affect a better cure, prevent recurrences, and also prevent progression in these patients with early stage bladder cancer.